Angular cheilitis, a common problem that affects many people, from children to adults and especially the elderly. But what exactly causes this condition? What are its main symptoms? What complications can it lead to? And what kind of skin changes might remain even after it heals? We'll also go through the proper treatment steps and highlight the most important vitamins, minerals, and daily habits that can help prevent it from coming back. Stay tuned. Peace be upon you. I'm Hussein Lotfi, and you're watching the Octopus Pharmacist channel. Welcome to a new episode of From A to Z Derma. At the beginning of each episode, we always start with a quick look at today's main topics. If you're here for a specific part, feel free to jump to the section that starts with that title. But if you'd like to understand everything about angular cheilitis in full detail, stay with me from start to finish. As usual, let's begin with a simple overview to understand the basics of today's condition. First, remember that the word cheilitis is a general medical term that simply means inflammation of the lips. There are many forms and causes of lip inflammation, but today we'll focus on 4 of the most important types. After that, we'll take one of them, angular cheilitis, and explore in detail. 1. Granulomatous cheilitis. From the name itself, this type involves swelling and inflammation of the lips. It may happen due to allergic reactions to certain substances, such as cosmetics or lip products, or as part of systemic diseases like Crohn's disease. It can also appear after lip trauma or injury, which triggers swelling and inflammation as part of the healing response. 2. Eczematous cheilitis. The word eczema means skin hypersensitivity or irritation. This usually occurs when the lips come in contact with irritating or allergenic substances. The body's immune system reacts, causing itching, redness, dryness, and cracking. Common triggers include lip balms or moisturizers containing fragrance or colorants, cosmetics, toothpaste, or even certain foods and drinks. Many toothpastes contain ingredients that can irritate the lips when they touch the corners or edges, leading to this form of eczema. 3. Exfoliative cheilitis. This type is linked to excessive peeling or flaking of the lips, far more than normal. In most cases, it's chronic and may have hereditary or behavioral causes. Some people unconsciously peel their lips due to stress or obsessive-compulsive behavior, while others constantly lick or bite their lips, worsening the problem. It can also be associated with vitamin B-complex deficiency, which affects skin regeneration. In all cases, this excessive peeling leads to irritation, dryness, and inflammation. 4. Angular cheilitis or angular stomatitis. Now, let's move to the main topic of today's episode, angular cheilitis. As the name suggests, cheilitis means inflammation of the lips, and angular refers to the angles or corners of the mouth. This condition affects one or both corners of the lips, causing cracks, redness, and pain. Typical symptoms include whitish discoloration at the corners of the mouth, painful fissures or splits that worsen when opening the mouth, eating, drinking, or even smiling, crusting and soreness around the affected area. Without proper treatment, the irritation can worsen and may even leave dark or light marks after healing. This happens because inflammation affects the melanocytes, the pigment-producing cells in the skin. When these cells are overstimulated, they produce more melanin, leading to post-inflammatory hyperpigmentation, meaning the area becomes darker after healing. If the cells are suppressed, the opposite occurs, post-inflammatory hypopigmentation, leaving lighter patches after recovery. This process is common in any prolonged inflammation where the skin's immune response affects pigment cells. In the next part, we'll talk about the main causes of angular cheilitis, the treatment steps used in dermatology, and the most important vitamins, minerals, and habits that help prevent it from coming back. Stay tuned. We're just getting started. The second topic in today's episode is a very important one. After learning how angular cheilitis looks and behaves, let's now understand what causes it, why the corners of the mouth get inflamed, cracked, or painful. There are 4 key reasons, and by understanding them, you'll easily predict the treatment steps that follow. Let's go through them one by one. 1. Severe dryness and dehydration. This is the most common cause. When the body lacks enough fluids, the lips and corners of the mouth lose moisture, leading to cracks and inflammation. Many people think this means drinking plain water only, but that's not entirely true. Fluids can come from water, natural juices, fruits, and vegetables, all of which contain a high percentage of water. What matters is your total daily hydration. A simple rule: for every 30 kilograms of body weight, you should consume about 1 liter of fluids per day. So, if you weigh 60 kilograms, aim for about 2 liters daily. At 90 kilograms, about 3 liters, and if more, around 4 liters per day. Good hydration helps repair and rebuild skin tissue, as proper water balance is essential for cell regeneration and healing. 2. Deficiency of vitamins and minerals. A lack of certain nutrients makes the lips and skin around the mouth more fragile and slower to heal. The most important ones are iron and folate, essential for red blood cell formation and oxygen delivery. Zinc promotes tissue repair and boosts immune defense. Vitamin B complex, especially B1, B6, and B12, vital for skin and nerve health. Also, don't forget the importance of proteins and healthy fats, which are crucial for rebuilding damaged skin. 3. Smoking. Smoking has a direct negative effect on healing. It reduces blood flow and oxygen to tissues, delays cell repair, and weakens the lip's natural barrier. Studies have also shown that smoking increases the risk of recurrent inflammation and slows recovery after any lip injury or infection. 4. Candida infection, yeast overgrowth. Candida is a fungus that normally lives in the mouth in very small amounts. It's usually harmless. But when the immune system becomes weak, this fungus can multiply excessively and start attacking the corners of the mouth. This leads to the typical cracks, redness, and pain seen in angular cheilitis. It can occur in children, older adults, and especially in people with weakened immunity, such as those with diabetes, those using corticosteroids or immunosuppressive medications, or patients who have had organ transplants. In these cases, once immunity drops, Candida grows rapidly and targets the lip corners, causing the painful lesions we described earlier. So, these are the 4 main causes of angular cheilitis: dehydration, nutritional deficiencies, smoking, and Candida infection. Understanding them is the first and most important step toward effective prevention and treatment. Stay tuned, because next, we'll talk about the best treatment steps and preventive habits that protect you from this recurring condition. Now we've reached the third and penultimate part, the treatment steps. Since we already understand the causes and nature of angular cheilitis, let's now go through the treatment plan step by step, in a simple, organized, and effective way. Step 1. Proper cleansing of the affected area. The first and most important step is cleaning. Always wash the lips and surrounding skin, gently using a medical or mild cleanser, free from perfumes or alcohol. Avoid harsh soaps or fragrance products, as they can increase irritation and dryness. Proper cleansing helps remove debris, bacteria, and yeast, preparing the skin to absorb treatment creams effectively. Step 2. Topical antifungal creams. Because one of the main causes of angular cheilitis is Candida infection, the next step is using an antifungal cream. Choose creams that contain clotrimazole or miconazole. These are reliable antifungal agents. Apply a thin layer twice daily, directly to the corners of the lips. Be careful not to let the cream enter the mouth. It should stay on the outer skin only. Step 3. Oral antifungal medication in specific cases. This step is only for people with weak immunity, such as diabetic patients or those taking immunosuppressive medications. In these cases, topical treatment alone may not be enough, so we add oral antifungal capsules. A common example is fluconazole. Take 200 milligrams on the first day. Then, continue with 100 to 150 milligrams once daily for about 2 weeks. However, this step is not used for children. For them, Topical antifungal creams are enough. Adults with normal immunity also usually recover without needing oral medication. Step 4. Adding an antibacterial cream. Angular cheilitis often becomes a mixed infection, meaning both fungal and bacterial germs are present. You'll notice this if the cracks start producing yellowish discharge. That's a sign of bacterial involvement. In such cases, use a topical antibiotic cream, such as fusidic acid, to control bacterial growth. You can mix the antifungal cream and the antibacterial cream together and apply them twice a day. Just make sure both are cream-based, not ointments, because mixing different consistencies like oil and water reduces their effectiveness. Step 5. Short-term use of a mild corticosteroid. For a short duration, about 5 to 7 days, you can use a mild corticosteroid cream like hydrocortisone. Its role is to reduce swelling, redness, and inflammation, helping the lips heal faster. Apply it 2 to 3 times daily, but do not continue long-term, because prolonged use can weaken the skin's immunity and cause side effects like skin thinning or irritation. If inflammation is mild and the patient can tolerate it, it's best to skip this step entirely and continue the other treatments only. Step 6. Restoring vitamins and minerals. Since nutritional deficiencies are one of the main causes of angular cheilitis, supplementing with essential vitamins and minerals is crucial. Important nutrients include iron, folate, and vitamin B12 for blood and tissue regeneration, zinc and copper for immune support and wound healing, calcium, magnesium, and vitamin D for general tissue health. These are often combined in multivitamin or iron capsules, such as ferroglobin, taken once daily. In addition, make sure to eat a balanced diet rich in proteins, because protein is vital for repairing and rebuilding skin. Step 7. Continuous moisturizing and lip protection. The final step, and one of the most essential, is moisturizing. Choose fragrance-free, medical-grade lip balms or creams designed for sensitive skin. Moisturizers help restore the natural skin barrier, reduce dryness, and promote regeneration. Regular use will allow the lips to recover completely, restoring their normal color, smooth texture, and flexibility. Summary. So, to summarize, clean the area gently. Treat with antifungal and, if needed, antibacterial creams. Use mild cortisone for a few days only if inflammation is severe. Support healing with vitamins, minerals, and proper nutrition. Keep the lips hydrated and protected with fragrance-free moisturizers. With these steps, angular cheilitis usually improves within 1 to 2 weeks, and with proper care, it rarely comes back. Stay consistent with your routine, and you'll keep your lips healthy, smooth, and free from pain. The fifth and final point in today's episode, and perhaps the most important, is the key instructions I always give to any patient suffering from angular cheilitis, alongside the treatment plan we've already discussed. These simple steps not only help a condition heal faster, but also prevent it from coming back again. 1. Identify and eliminate the cause. This is always the first and most essential rule. There's no point in applying creams or taking medicine if the main cause of the problem is still present. If the patient has a chronic disease such as diabetes, high cholesterol, or another underlying condition, they must follow up with their primary doctor to keep it under control. Poorly managed health issues often slow healing and make the lips more prone to infection. If the cause is external contact, such as using irritating lip creams, makeup, or toothpaste, or even constant lip licking, it's crucial to identify and stop that trigger. Avoiding the cause is a foundation of recovery. No treatment will work properly without this step. 2. Oral and lip hygiene. The second point is all about keeping the mouth, teeth, and tongue clean. Many people don't realize that poor oral hygiene can directly worsen angular cheilitis. When choosing a toothpaste, avoid those that create strong foam, because this foam can spread to corners of the mouth and cause further irritation or dryness. Instead, use a gel-type toothpaste with mild foaming agents. Brush your teeth twice daily, using a soft bristled toothbrush to prevent irritation of the lips and gums. Also, clean your tongue regularly using a tongue scraper or toothbrush. This helps remove candida fungus, bacteria, and food debris that can collect on the tongue surface and contribute to reinfection. Additionally, if you have dental issues, gum infection, sinus problems, or throat inflammation, make sure these are treated promptly by your doctor or dentist, as they can be ongoing sources of infection. 3. Maintain a healthy diet and good hydration. The third point is about nutrition and hydration. A healthy diet should include vegetables, fruits, and high-fiber foods, as they supply essential vitamins and minerals naturally. And don't forget proper hydration. Water is key to maintaining soft, healthy skin. As mentioned earlier, nutrients like iron, zinc, folate, and vitamin B complex are best absorbed through food rather than supplements whenever possible. Balanced nutrition strengthens the immune system and speeds up lip healing. 4. Avoid lip licking. This is one of the most common mistakes people make. Constantly licking the lips might feel soothing for a moment, but it actually makes the condition worse. Here's why. Saliva contains digestive enzymes meant to break down food inside the mouth, not to stay on the skin. When saliva repeatedly touches the lips, the body starts to treat it as an irritant. This leads to redness, irritation, and even inflammation, often marking the beginning of angular cheilitis. Most people lick their lips because of dryness, so the best solution is hydration and regular use of fragrance-free moisturizers to prevent that urge. 5. Protect from sun and heat exposure. Finally, avoid direct sunlight or strong heat sources for long periods. Sun and heat cause the skin's moisture to evaporate, leading to dryness, redness, and irritation, which can easily trigger the condition again. If you must be outdoors, use a lip balm with SPF protection and reapply it frequently. In summary, by following these 5 essential tips, along with the 5 or 6 treatment steps we discussed earlier, angular cheilitis can completely heal within 1 to 2 weeks. The lips regain their normal color, texture, and comfort, as long as you continue preventing the causes that triggered it. Today, we talked in depth about angular cheilitis, from its causes, symptoms, and treatment to the best prevention habits. I hope this episode gave you clear, practical, and useful information. If you enjoyed this video and found it helpful, don't forget to like, subscribe, and share it to support the channel. And if you'd like to help us grow, you can also support the channel through Patreon, PayPal, or YouTube memberships. Thank you for watching, and as always, stay healthy and take care of your skin. Good night. Hussein Lotfi.